Numbness is scary, especially whenever it's happening in your hands, and most specifically whenever it's happening in your thumb. That's how you grip the steering wheel, it's how you open doors, it's how you let people know that you're okay after you face planted doing a somersault off that picnic table. But what a lot of people get wrong is they assume that because they have numbness in their hand, it must be carpal tunnel syndrome. And then they go through the whole process of surgical intervention, getting that flexor retinaculum cut open, and they're still left with numbness. So today, what I want to focus on is determining if your numbness is actually coming from your wrist, or if it might be coming from somewhere else in your body. Because the only thing that's worse than having a numb thumb is having a numb thumb and an incision in your wrist. So we're going to save you the trouble of surgery and see if your thumb numbness is actually coming from your wrist or if this is something you can easily fix on your own. That's fun to say. Thumb numbness. Thumb numbness. Thumb numbness. Here's a little fun fact about hand numbness in general. A lot of the time people want to think that because their hand goes numb, it must be coming from carpal tunnel syndrome. But realistically, one of the things that I've noticed at the office over the last 6 years is that a lot of disc issues actually come on atraumatically, meaning nothing cool has to happen for a disc to bulge or even rupture and put pressure on that nerve root to cause numbness or weakness in that arm or hand. But most people don't get told this, and this is actually something that has shocked me over the past couple years, is they will go to a doctor, say they have hand numbness, and almost nothing is done to see if there's a non-surgical intervention. They pretty much just say, yep, hand numbness, we're going to send you in for a nerve conduction study, make sure that you are experiencing some sort of entrapment, and cut you open. But here's the thing, what if you don't have nerve entrapment in the forearm, but instead you have it all the way at your nerve root up in your neck? Then you're going to be getting cut open for absolutely no reason, because it doesn't matter how much space you open up in your wrist if what's pinched is all the way up here. But then how does stuff like this happen, specifically for the thumb and the pointer finger? Well, in that case, we would be looking at your C6 nerve root, which is going to be close to the bottom of your neck. A lot of the time, this nerve root can be affected by quick head motions, traumas to the neck, traumas to the head, but it's also not unheard of to have a disc bulge just from sleeping incorrectly. And for your C6 nerve root, this is a bit of a problem because that part of your neck is highly involved in bending your neck from side to side. So that motion that joint is responsible for compromises the disc, which then puts extra pressure on the nerve, and you get worsening symptoms in your thumb. This is scary because nerves are not only information highways where you get sensation signals from your hand to go back to your brain so you know that you're touching a hot stove, maybe you cut your finger on a knife or a piece of paper, or maybe you're just having a hard time flipping through your mail. But those nerves also send signals out, meaning that they are responsible for motor control, the flexing of your bicep muscle, and your wrist extensors. Which at first doesn't sound awesome, and it's not, but the good news is that does allow us to test and see if your symptoms are coming from your neck or your wrist. So first, let's make sure that those upper extremities are still strong. What you're going to want to do is on the side that's giving you problems, extend your wrist, meaning point those knuckles up, sort of like you're riding a motorcycle. And then what I want you or a friend of yours to do is try to pull that wrist out of extension. If you can't hold your wrist in that position, it might be a sign of your C6 nerve root being compressed. Additionally, if you kind of have mixed signals as to what's going on with your wrist extensors, maybe they're just weak, maybe you have arthritis in your forearm and it's kind of tough to do this anyway, then you're going to test your bicep muscles. You can do this with a friend or by yourself. And all you're going to do is on your affected side, so we'll say my left for this scenario, is you are going to try to bend your elbow with your left, and then with your right, you're going to try to straighten that arm. And you should feel a contraction of this muscle here in the front of your arm. If that muscle feels weak, or like it gives too easy, and try comparing this to your unaffected side, then again, that might be a sign that you have disc compression further up in your neck. That being said, just because something's weak doesn't mean that we shouldn't test other routes to make sure that we don't have other nerve problems going on. So, for that numbness in your hand, we're going to say it's your right. What I want you to do is kind of that Rockstar symbol, because what it's going to do is highlight these two tendons that are running along the bottom of your forearm, and that is where your median nerve will run. This is the one that's synonymous with carpal tunnel syndrome. And if you tap hard on that space between those two tendons and have shock or numbing pain going into your hand, that is genuine carpal tunnel syndrome. That being said, your thumb is at least going to be partially innervated by your radial nerve, which is going to run just to the side of this tendon and before this bone. And if you tap in that area and you're similarly having numbness sensations in that thumb and pointer finger, that would be indicative of compression in that forearm and that your nerve symptoms actually are coming from your wrist. But here's the kicker, because you can have a disc bulge in addition to carpal tunnel or radial nerve compression. You get extra lucky. You have damage and compression at both sites that can cause irritation. And this is why you want to look at both sides of that nerve, because if we just think it's coming from the neck when it's coming from the wrist, we have a problem. If we think it's just coming from the wrist, but it's actually coming from the neck, we still have a problem. If it's coming from both and we only address one, you get the point. Now, the final bit of fun is seeing if maybe putting our head in a compromised position doesn't also add compression to that C6 nerve root, which sounds super scary. It's not. All you're going to do is extend your neck, look up at the ceiling, and see if that doesn't worsen your numbness in your hand. That numbness might not be immediate, but if you give it a couple seconds of keeping your head in that extended position and you start feeling the pins and needles in your thumb, then that is letting you know as we close those joints in the back of your cervical spine that we are compressing that nerve root further. And that might be coming from a disc compression. It could also be coming from arthritic changes in that joint opening, which you would want to confirm either on X-ray or an MRI. And some of you might be thinking, well, thanks, Dr. Beck. Now I thought I just had a disc issue, and it turns out I have a disc issue, arthritis, and carpal tunnel syndrome. This just keeps getting better and better. How could it possibly get any worse? Well, I'm going to tell you. Because when a nerve is compressed, the signals it conducts start to die down, meaning that over time, you might start developing some permanent damage to that nerve. The same way you can crimp a wire that goes to your electrical lights, you can crimp a nerve for so long that it starts to take on damage. Which is why diagnosing where the cause of compression is actually coming from is so crucial, because otherwise you fix what you think is a problem, you still have compression, and then the nerve starts to degenerate. But as always, I'm not going to give you the bad news and not give you any way of fixing this at home on your own, which is why we're going to show you how to open up that C6 nerve root disc space so that it alleviates some of your numbness symptoms or weakness symptoms in that upper extremity. Now, the good news is this is a pretty straightforward remedy. All you're going to do is we're going to say that this right side is the side that's affected. And what we are going to do is drop that shoulder blade, sort of like we're reaching towards the floor, but don't allow your shoulder blade to pull away from your rib cage. So just drop that down slightly and tilt your head gently to the left. Gently, that is always the emphasis word. This is not so much a stretch, but what we are doing is opening that joint capsule so that that disc isn't compressed and it can take some of the pressure off of the nerve. That being said, just because we get temporary relief of numbness symptoms doesn't mean we are fully removing the pressure from that nerve. If you're in the Pittsburgh area, by all means, drop by the office. We can give you a solid evaluation and figure out if this numbness is coming from your neck or from your wrist, and then treat you accordingly. But if you can't make it to the office, there's a couple other things that we can do to help you out. 1, check out the free resources that I have available down in the description. I'm always adding to that library to give you a better idea of how you can get started determining exactly what is injured, where you should go to seek help, and what you can do in the meantime to make yourself feel better and recover properly from soft tissue damage. Additionally, feel free, there is a link for Designs for Health. They sell a supplement called alpha lipoic acid, And that is super useful for nerve damage to help kind of break down the metabolites that accumulate in the nerve and cause a lot of long-term irritation. And finally, if those free resources don't help and you can't make it into the office, check out the Cervical Disc Recovery Blueprint. At the time of recording this, I am currently in the final stages of getting it all put together, but this should ideally help guide you all the way from experiencing disc herniation symptoms to fully recovering so that you have full feeling back in your upper extremities, that you don't have any strength loss, and that also you don't have any permanent damage that's stemming from disc herniations or bulges in your cervical spine. Because frankly, since opening the practice, one of my biggest pet peeves is how often patients come here terrified that they're going to need to get some sort of surgery for nerve entrapment. And while nowadays carpal tunnel surgery isn't that bad, it's still annoying to see that no one's taking the time to diagnose what's actually going on with the patient before saying you just need to get cut open. You know, today we talked about your C6 nerve root, your thumb, and like I said, it's super useful for gripping onto things, flipping through your mail, reading a book. But this goes for any of the sensations in your hand or your arm. And rather than running the risk of them going in to open up that nerve and then accidentally cutting something that's super important and causing long-term damage, I'd rather you take a more conservative approach and get fixed up naturally so that you can get back to the normal day-to-day things you do with your hands, like driving your car, opening your door, picking your nose, or just giving this video a thumbs up. See what I did there? That was off the cuff. That's impressive. But with that, I'm Dr. Beck. Thank you so much for watching. If this video was useful for you, please leave it a like, because this information, for whatever reason, is hard to come by, but super useful for people trying to figure out if they do or don't have carpal tunnel syndrome, and if they do or don't need surgery. So if you know someone trying to figure that out for themselves, share this with them, help them out. And I hope that this video helps you to make the most of your one life.